Hi, I'm Dr. Keshishian, and welcome to our podcast series, PPE, Podcast for Psychoeducation during the COVID-19 pandemic. I'm joined today by a familiar voice. You may remember Dr. Tom Jha, a fourth-year psychiatry resident from our very first episode. Today, he will be talking with Drs. Darren Morris and Dr. Tyler Wright, both resident physicians at LAC+USC, about how COVID-19 is impacting our younger doctors. Hi, everybody.
Thank you, Dr. Keshishian.
Hello.
Today, we are going to discuss life as a resident physician during times of COVID, dealing with working during the stressful time, and how the pandemic has affected relationships with friends and family. Dr. Wright and Dr. Morris, you guys are both residents in the LAC+USC system. For the audience members that may not know what that is, what is a resident physician?
We're people who have completed our medical school, and now we're doing our training before we become attending physicians. I think the best way to describe it would be that we're doing an internship and getting hands-on training on how to become a physician in our respective fields.
And it's my understanding that you guys are often the ones in the front lines of the hospitals and the emergency rooms and situations like those.
Yeah, especially at LA County USC, I would say our hospital is definitely more of a resident-run hospital where in the mornings, we go and see our own patients, and then we round with our attendings and come up with our own plan. And then the rest of the day, we're the ones that are like doing the procedures, seeing the patients, taking care of like any upgrades to ICUs that have to happen, admitting new patients and discharging them.
With the COVID pandemic happening right now, I'm sure you guys on the front lines are seeing the most changes in your lives. How has COVID affected your day-to-day life?
Well, we manage about 16 or so patients on any given day. And I would say about a third are COVID positive, whether they come in symptomatic from COVID, meaning they're kind of short of breath and they're requiring some oxygen, or they end up like just incidentally having COVID. As nowadays, every single patient that gets admitted to the hospital is tested for coronavirus. And so some of them are asymptomatic and incidentally come back positive.
Can you describe a patient encounter that was especially memorable for you in these times?
Yeah, sure. I had the pleasure of working with this one 72-year-old female. She came in symptomatic from COVID. She actually, unfortunately, ended up having to get intubated. Fast forward to a week ago, I ended up taking care of her husband, who came in asymptomatic from COVID, but unfortunately, the wife was the husband's caretaker, and so he was kind of missing taking some of his chronic medications and pills, and he ended up having to come in. I kind of informed him what was going on, and we were planning to send him out to a skilled nursing facility just to get a little bit more physical therapy so he can get stronger to get back to his house. And unfortunately, his wife is about to pass probably within the next kind of week or so, and we're getting ready to send him out to a skilled nursing facility. I didn't think that he would ever get another chance to see his wife. So I put him on like in the surgical gown, I put mask on him, put a face shield on, gloves, and I actually wheeled him down to go see his wife in the ICU. And it was pretty emotional, but I think he really appreciated it.
Wow, what an incredible story.
Yeah.
It's amazing that you're not only doing your job as a physician treating their illness, but you're connecting them in a way that they really needed to and potentially her final moments.
And I felt like it was definitely something that I could do that obviously would mean the world to him.
Was there anything that these patients told you that really stuck with you and kind of inspired you to continue what you're doing?
I mean, it is so scary for them. I mean, coming in with COVID, it's just reassuring them and telling them that we're here for them, and just being like compassionate to these patients that are going through this like really scary pandemic themselves, isolated in these rooms, not having like as much contact.
Yeah, I imagine in a time like this where we don't know enough about the virus, we don't know enough about the treatments, the human aspect of being a doctor is more important than ever before. Thank you so much for sharing.
Yeah.
Dr. Wright, as a psychiatry resident, what have you been seeing from our patients lately?
From the psychiatric standpoint, we are seeing a lot of patients who are having exacerbations of their mental illness because of their fear or things that are going on in their lives due to coronavirus, whether that means socially, not being able to work, homeless, not being able to find a shelter as easily because of a lot of the restrictions that are happening.
What are some specific stressors your patients have been telling you about in the last few months?
some of the main things is a lot of patients feel very isolated. That can worsen their depressive symptoms or their anxiety. I recently saw a young gentleman who was having really severe panic attacks that had just started recently because of everything going on with coronavirus. And his anxiety was also increased as well. So it's just a big fear that patients have of either contracting the illness or not being able to see loved ones or not being able to do things they were doing previously.
For a lot of our audience out there, we don't have a very good idea of what it's like to work in the hospital day to day. And the only avenues we have to see that are from TV shows such as Grey's Anatomy. Something that always struck me about these shows was that the residents were spending so much time together, and it seemed like they were together inside of work, outside of work. They were best friends. Is that aspect at all similar to reality?
I mean, if you spend like 13 hours a day in the hospital, you only have like a few hours left in the day to either, like, I always say I get to pick three: exercise, make dinner, or go to bed early.
I often choose going to bed early in that.
Yeah. And then recently now it's just 1 out of 3.
Yeah. And I think one thing they don't really show is that we have to sleep, and they don't really show that in the TV shows. It's like they're never sleeping. They get to, go out and enjoy other things. Well, we do at times get to do those things, but it's a lot harder. You have to sacrifice a lot.
Especially working like 6 days a week, you have 1 day to recover. And then normally the following day, I'm even more tired than the day I had off.
Yeah. And before, when you have a day off, you could spend it doing a lot of things that could re-energize you, going outside, seeing your friends. That's kind of been curtailed because of the coronavirus situation. How have you guys been able to adjust to that?
That's been a huge challenge that I've struggled quite a bit with. No gyms. Gym was usually my main outlet, and so I've turned to running and doing other things that I can try to find, but that's also been very challenging. Yeah, not being able to go out. I think it's something that we're all really struggling with.
Yeah, no, I definitely, as soon as I get home each day, I like take off my scrubs, I jump in the shower, I take my temperature, then I wash my scrubs just to like keep my partner safe at home. But then I'm fortunate to live close by my family, but I have my elderly grandmother sees my immediate family. They're in like kind of their quarantine pod, so they're only kind of seeing each other, and I don't necessarily want to break into that because of all people, I'm like the highest risk dealing with these COVID patients, so I'm scared to see my family.
It must be hard to have to take care of COVID patients every day, but also try to keep your family and your loved ones safe.
I had some possible exposures, so there's like that gets factored in, and it's not always easy even for us to get testing, which can be a little bit frustrating. So there is a component of us having to kind of like pick and choose when and if we can see certain family members. And then we've been using Zoom as a family to see, like, my grandma, for instance, who's in her 80s and has a pre-existing lung condition, so she's incredibly high risk. But yeah, I mean, this is challenging. My wife's an OBGYN resident, so it's like we're constantly both possibly getting exposed and then maybe exposing each other, and then our coworkers. I mean, there were a few psych residents that got tested and were positive, and I interacted with them. So it's challenging. It's anxiety provoking.
Yeah, unfortunately, testing it's in short supply, but thankfully I haven't had any symptoms, but who knows, in theory I could be asymptomatic. So that's always kind of like in the back of your head.
I think it's nice to hear that even doctors are kind of struggling with how to balance their safety and living their lives, and that, you guys feel anxious too and have have the same uncertainties about it. There are a lot of young adults out there that seem to be believing that there's no way that they'll get sick. They don't have a pre-existing condition, and they're young, so they won't die. And so maybe they won't wear a mask. Maybe they'll have large gatherings. What are your thoughts on that?
I can say firsthand, in the last 3 weeks in the hospital, I took care of a 22-year-old, 24-year-old, a 27-year-old, and a 33-year-old that were hospitalized with COVID. So I think that's enough evidence as is. It can affect anyone.
Yeah, I think I can understand people's frustrations with wanting to go out, because I have those frustrations as well, and so do all my coworkers and my family members. However, I also find it a little bit frustrating when we are here working very hard and I'm doing the best I can. And I'm not saying I've been perfect, but it can be frustrating to see people out in the community gather in large gatherings, because at the same time, like, you're not maybe at risk to harm yourself, but you may be at risk to spread it. And then that creates like this really bad situation where inevitably people here at the hospital are going to suffer. I would just encourage people to wear masks as much as possible and try to limit the amount of contact that you have with other people. But again, I understand, like, we're all frustrated. This sucks.
What can we do as a community to help fight this pandemic and get through it together?
I think education is really important, and making sure that you're going to the right sources for learning about what to do. Wearing a mask, it's very easy to do. I don't like doing it, but I do it because I don't want to put other people at risk.
I think you hit the nail on the head, kind of following the rules at this point that are set by people that are definitely smarter than me.
It sounds like if we all work together and have a single-minded game plan, that we'll all come out of this better.
I wanted to thank all three of you for joining the podcast today. I think it provided a real view on how this is affecting our doctors in training, but our senior residents more than anything, because you guys are leaders for other young doctors, and to hear your perspective is very refreshing. So thank you so much for that.
Thank you, Dr. Wright and Dr. Morris. It's been a real pleasure.
Thank you for having us.
Thank you.